One of the major items in any practice, and should be probably the number one thing in every practice, is dentistry. And one of the main things you do in dentistry, unfortunately, is extract teeth. And following extraction, we get atrophy of the alveolar ridge and then a weakness in the jaw, especially on the canines and the carnasals and around the incisor teeth. So we end up with very weak symphysis of the jaws, areas in the jaw that become very weak and prone to fracture.
Consul, as a synthetic bioactive bone graft material, is something that is invaluable with a lot of the problems that you'll see in dental patients. Consul is used primarily to fill tooth extraction sites, but can also be used for periodontal pockets, as well as, for example, fractures of the mandible.
Consul is basically an implant material that is for bone augmentation, or to maintain the alveolar ridge, especially after extractions. So it acts as an osteoinductive material to help get bone to grow in through the implant material and to basically reinforce and get new bone to the area to maintain the health.
Consul works by filling in bony defects, and it acts as scaffolding because it has osteoconductive properties. It brings in the cells needed to make new bone, and eventually new bone replaces the consul that's been put in the bony defect. What happens then is that you no longer have that hole where the tooth has now been removed, and you have the consul filling in that space, which not only makes the patient more comfortable, a quicker healing time, but eventually that consul will be replaced by new bone growth. So you no longer have the predisposition for the teeth next to the tooth extraction site to loosen and to have problems. You also no longer have the thin jaw that's left below or above where the tooth has been extracted, because you will have new bone filling in that tooth extraction site.
We basically explain to the client the benefits and the changes that occur following extraction. That normally over the next 6 to 18 months, we will typically see somewhere between about a 5% to as high as a 60% atrophy of the alveolar ridge in the area of extractions. The more major the tooth, the more atrophy we see, and also the older the animal, and also according to the amount of disease that's in the area. And once we explain to them that we normally are able to maintain between 85 and 99% of the alveolar bone height following extraction when we use the implant material, normally there's no problem in the people accepting its use. They want it. They respect us for using materials that's going to keep the alveolar ridge in their dog healthy and keep their animals' jaws healthy, so that they don't have to worry about them atrophying, getting weak, and being more prone to fractures later on in life.
It can be either poured directly into the tooth extraction site and mixed with the blood that's already there, or the consul can be mixed separate from the tooth extraction site with blood or saline and then applied to the defect. It's only necessary that you're familiar with a very straightforward flap to hold the consul in place.
Basically, following extraction, of course, we gently just curette out the empty alveolus, or the bone socket where the tooth is removed. You just gently pour in the material, fill it full, and then you need a few little cruciate sutures to close the flap closed. Now you may have to undermine the gingival tissue a little bit, or in a major extraction do a flap, but that's only a few minute type of procedure. So it's very simple and very quick to close these, and it's a tremendous benefit to the animal long term, especially if you're doing extractions at a young age. Long term, you see a lot of atrophy in the jaw, and it's just unnecessary to see these fractures and problems later on in the animal's life. As far as bleeding at the time of extraction, normally when you suture, this helps control the bleeding. Plus, when we put consul in the extraction site, we get a couple of benefits. It actually helps in clot formation, number one, which helps with the controlling of the hemorrhage. But number two, the blood that seeps out of the bone is very rich in bone morphogenic proteins. So actually the blood that's coming from this alveolus extraction site is excellent towards getting us a good, healthy clot formation and new bone from the benefits of the consul, and then with the bone morphogenic proteins that seep in from the adjacent bone structure. So the blood is actually a benefit to healing and to the actual progression of good, healthy bone growth in the area. On healing time and so forth, healing is always enhanced anytime we can actually pack material into the area and stimulate early clot formation and good healthy clot. And then with the suturing, this will make it a lot less painful. Extraction sites left open with exposed bone are painful to the animals. And if we go in and we do our extractions properly with proper anesthetics and so forth, and we pack our console and suture, the animal is going to heal much faster, and he's going to be feeling much better and heal quicker. No comparison, really, no comparison. Console has a relatively high pH, a very stable pH though, and so therefore it normally does not cause any kind of tissue damage, but the slow release and the high pH actually helps to inhibit bacteria. So putting it in an infected area is not a problem. We'd rather, of course, clean the infection up before we put it in, or the simplest thing is if we've got an infected tooth, normally when we remove the tooth, the infected granuloma is at the apex. So when you pull the tooth, if you just curette this material out, it does fine because it comes in 2 little dampened dishes, and each one about 2.5 cc's. So we've got about 5 cc's of material there. And the typical dog, even in a large canine tooth, most of these will take somewhere between 1/3 to maybe a full dampened dish. But on average, maybe 1/2 of 1 dampened dish for the average canine tooth extraction.
Console's very economical. With most tooth extraction sites, you might use 1/2 to 1 cc to fill in that site, but of course it depends on the size of the tooth that has been extracted.
There are other products, but also there, as compared to price, there's nothing that really compares. It's very economical to use in extractions, and especially for smaller teeth. So you shouldn't avoid packing it in small extractions. We get a benefit even from the smallest tooth extraction. Packing it, we save a little bit more alveolar bone.